So let's keep focused on this critical issue because this morning we're getting more perspective on that possible treatment for COVID-19 that's getting a lot of national attention. On Sunday, the Food and Drug Administration granted an emergency use authorization for convalescent plasma. The treatment separates plasma from the blood of someone who has recovered from COVID-19. Now, the blood gets pumped back into the donor's body, and the plasma can be used on a patient who has the coronavirus. Dr. Nicholas Parros, he's the medical director of transplant and infectious diseases at IU Health. He says the treatment is one of many being studied.
In terms of the mortality benefit, it's difficult to know which one of the interventions that we're doing is actually given the major advantage to the patients, and it's perhaps even a combination of them that is giving advantage to the patient. So it's really difficult to pinpoint which one is giving this impact.
And so we have more information about this, Lauren. At least one central Indiana patient credits the convalescent plasma with helping save his life. I want you to meet Dave Falkenberg. He spent a month in the hospital.
And Rafael, at one point he was in a coma. He's just grateful doctors gave him the plasma treatment option.
It was the treatment that got me over this. It brought me back to where I would feel better and my body could overcome this. What I like people at home know is that it is so important that we all get involved. If you can be a donor, I would highly recommend that. There's nothing better than helping somebody else out. It always comes back to help you out.
It's great to see him up and recovered from that. The FDA does say that approval is not the same as authorization, and this is not a cure that we know of yet. So the goal is to gather more information right now and to gather more plasma. So this morning, health officials say there's still a lot of data to collect on this treatment, including putting it through randomized controlled clinical trials. Rafael.